Alright everybody, welcome back to another episode of Health Sucks. Today we're going to continue our discussion on the cardiovascular system, although we're going to tie in some other general anatomy topics as well. For example, we're going to tie in some GI anatomy, and we're also going to put in some big picture stuff. So as a clinician, you're going to have to know about the abdominal regions. There's 9 regions of the abdomen that you are going to have to know about as a clinician. And I'm going to get Dr. Tato out here to tie that all in, and he's going to explain some big picture stuff as well towards the end. So I hope you guys can stick with us, and today I hope we have a good time and we learn a whole lot together. So let's start this, and let's just put a big picture up. So guys, what you're looking at right now is the descending aorta as it comes behind the heart from the ascending aorta. You're seeing I have the celiac trunk highlighted in blue. I have the superior mesenteric artery highlighted in orange, and then you see down towards the bottom is the inferior mesenteric artery highlighted in purple. And you see that there's also a bifurcation towards the bottom at L4. And I put the vertebral levels just to help you understand where this is kind of at inside your body. So you have at L4 a bifurcation, and these arteries are going to continue as the common iliac and run off into your legs. Now, this is a lot, but it's really not that much as well. There's going to be ways to help you break this stuff down. So come back to me and let's talk about it. The first thing we're going to talk about is the regions of the abdomen. So I'm going to get Dr. Tato out here to discuss the 9 regions of the abdomen first, because you have to start on the outside to be able to understand what's on the inside. So, Dr. Tato! Whoa!
Oh, hello there! Today we will be talking about the 9 abdominal regions. The abdominal regions are important clinically because you need to know where the organs are, because if patients come in complaining of localized pain, you can isolate which organ might be affected. So very quickly, John, I'm going to have you remove the bottom portion of your, pull back the bottom portion of your gown, but leave the top covered. And this gives us an abdomen. This abdomen is going to start below the ribs because that's where the diaphragm kind of cuts it off. And then we're going to go to about the ASISs because that's where the inguinal ligament kind of starts. So dividing it into 9, we're going to have 3 middle and 3 on the sides, the dividing line being the midclavicular line. This area is above the stomach, so we're going to call it the epigastric region. This area has a little belly button, so we're going to call it the umbilical region. And this area below is going to be called the hypogastric region. The areas on the sides are below the ribs, so we call them the hypochondriac region. The lumbar spine's in this area, so we call these the lumbar regions. And the inguinal ligament is here, so we call this the inguinal region. Starting in the top right hypochondriac region, we're going to have the liver and the gallbladder. The epigastric region will have the stomach, the duodenum, and part of the pancreas. The left hypochondriac region will have the spleen. The lumbars are going to have the kidneys. The umbilical region houses your small intestines. Your inguinal regions are very specific and very important. The right inguinal region will be where your appendix, your ileocecal valve, and your cecum are. The other side will have your sigmoid colon, and the hypogastric region is going to contain your uterus if you're female, and your urinary bladder, and that'll be it if you're male. And that is, something else to include is that the left and right inguinal regions will also have the ovaries and the uterine tubes if they're there.
Whoa! Alright, so now that we got that out of the way, I'm going to mark the regions of the abdomen off the list. So, what's next on the steps here? We have to go ahead and understand now and break apart the 3 main branches of the abdominal aorta to start to understand those organs that we just talked about and the separate blood supply that they get from each branch, regardless of the parent artery, which is what we're basically going to start talking about today. So again, pop that picture up, and I want you guys to look at the first one, the celiac trunk, the first one coming off of the abdominal aorta. It's the first main branch. So this is what we're going to start with here today. I'm going to start with this line, which goes off to the left to supply what? That's going to be the spleen. And then you have a line, 2 more main branches coming off. It's going to be the common hepatic and the what? Left gastric. And then that anastomosis, we have to know about anastomoses. I'll let Dr. Tato explain that later when he brings in and ties in the big picture stuff at the end. I'll let him explain what an anastomosis is. And then we continue off between the left and right gastric to go where? Well, we know that up here in the foregut, or towards the upper side of the abdomen, we have the liver in the right upper quadrant. So we know we have that. And then we have what? The hepatic artery, which supplies that. Which ones? Left and right. So no big deal, right? All right, so let's continue, guys. Working our way down, you have the proper hepatic, which passes the common hepatic and continues to supply the duodenum. Now this one's going to be a tough one, guys, because you have to know, and one more thing I forgot about, which was what's behind the liver. The gallbladder, which is what artery? It's going to be the cystic artery to the gallbladder. All right, so continuing down from proper hepatic to the right gastric epipleoic. Now, I don't want you to continue off over yet. I want you to keep going down. And what you see here is, look at this picture I have on the screen, which is the duodenum. You see the upper half of the duodenum is actually supplied by that posterior superior pancreatico-duodenal artery. So this is one of those ones where there's an exception, and Dr. Tato is going to explain this one as well, which is some organs usually have one main branch that supplies it, one artery that supplies it, but some get dual blood supply. So what's it mean when something gets dual blood supply? It most likely means that that organ itself has dual embryological origination. So again, Dr. Tato will cover that when he covers the big picture stuff. So what do I mean by that? Well, if you look at the picture here, you have the duodenum, which is separated by the posterior superior pancreatic duodenal and the posterior inferior pancreatical duodenal. That one comes from the SMA, which I haven't got to yet. So we'll talk about that when we talk about the SMA. So if you would, come back to me and look what we have here. 1, 2, 3. So this is the main picture of what it's going to look like. And again, you have the spleen, then you have the short gastric artery, supplies some of the stomach, basically the fundus of the stomach, the greater pancreatic artery, and then you have, sorry I didn't include, the dorsal pancreatic artery. So those are going to be the pancreas, and then you have the stomach. And remember, I didn't include as the right gastric epipleoic comes over yet, because you see the stomach here is supplied by the left and right gastric, and the lesser curvature is right here, so it would make sense that the greater curvature is going to be supplied by what? That right gastroepipleoic coming across, underneath, or behind the abdominal aorta, and coming back up to anastomose with this one, which is going to be the left gastroepipleoic, or the gastroomental. So again, a good thing to do, guys, is when you're confused, when you don't know words or names, is to look up what these words mean. So what is gastroomental? Omental means to float upon. So this is a artery that floats upon your gastric, which is your stomach. So what does that mean? Which side of the stomach does this float upon? If it's not the lesser curvature up here, it's going to make sense that it's the greater curvature down here that floats upon. So basically, that's everything that comes off the celiac trunk. And what else did we say about the celiac trunk? That its embryological origin is most likely the foregut. So whatever it supplies is most likely embryologically originating from the foregut. It sounds like a whole lot, but I promise it's not as confusing as it sounds the more you repeat this stuff. This is big picture stuff. This is pretty, you have to have at least, or I recommend you have at least one good picture of something that you want to memorize. And then when you're drawing it out, you break it down into the two-dimensional, the easiest way you can to help with spatial awareness. And you keep repeating and trying not to use that main picture and see how far you can get just off memory alone. So that's step one for the first trunk, which again is at the T12 level. So that's going to be the vertebral level that the celiac trunk is at. So let's continue on to the superior mesenteric artery and the branches that come off of that. All right, guys, so for step number 2, we're going to go ahead and do the second main branch coming off the abdominal aorta, which is the superior mesenteric artery. And we need to know big picture stuff here. What organs are going to be supplied here? So let's jump over back to that duodenum we were talking about with the celiac trunk, how the top half was foregut origin, and the bottom half is going to be separate origin because it has its blood supply from the SMA rather than the celiac trunk. So let's talk about that for a second. What is the bottom part, the second half of the duodenum's origin? If it's not foregut, it's going to be midgut. So that's the origin of that. And then what are the blood supply specific branches that supply this duodenum? It's going to be the posterior inferior pancreaticoduodenal artery, and if you have one of those, you most likely have an anterior inferior pancreaticoduodenal artery. And I might not have told you yet, but remember, these are separate from the other side, which is going to be the superior posterior and the superior anterior pancreaticoduodenal arteries. Those are tricky, and the teachers or professors that teach this subject will try to get you on that. So you must know about that. Continuing on, we have the common pancreaticoduodenal artery, which is a main branch coming out the SMA. Another main branch is going to be the middle cecal, middle colic, the right colic, and then the intestinal arteries, along with the iliocolic artery. Now, the iliocolic artery is an important one because it has several branches coming off of it. So, guys, let's work our way down here. Intestinal arteries supply the intestine. The middle colic is going to supply part of the colon, and the right colic is going to supply part of the colon. You can see it here. And then you know that the iliocolic is also going to supply the colon, but more specifically, the lower end of it. So what's on the lower end of the colon? If you look at this diagram here, you see that you have part of the appendix sticking out the bottom. And that's why you have the appendicular artery that supplies that. You have the bottom of the cecum, which is the anterior part and a posterior part, the posterior anterior cecal artery. And then what do you have? You have the cecal branch of the iliocolic artery, and that's going to supply, I believe, the proximal two-thirds of the transverse colon. And then I'll have Dr. Tato bring that in on the big picture tie-in. But for right now, that's pretty much all you need to see is how that connects. And then I'm going to show you how the other side connects with the not just the midgut, but also the hindgut, and how it has dual blood supply as well, because guess what? It also has dual origin. So let's go with step 3, and let's start talking about the eye. So for this third step, guys, we're going to go ahead and include the third main branch of the descending or abdominal aorta, which is the inferior mesenteric artery. So this one is going to be a little bit easier to understand. It's got less branches, and pretty much how I memorized the IMA first was that it was the only branch that supplies pretty much everything on the lower left side of the abdomen. So what do I mean by that? If you go ahead and look over here, look at how the colon has the ascending, transverse, and descending parts. Well, it also has a branch that supplies that. Remember I said something about, now I said it wrong because there's so many colic arteries that you sometimes get them confused. You know, you had several coming off of the SMA that I was talking about. So I might have told you wrong, but the middle colic artery supplies the proximal 2/3 of the transverse colon, as you see here. So what supplies the distal 1/3? It's going to be that ascending branch of the left colic artery, the ascending branch of the left colic artery. And then you have the descending branch, which is going to supply the descending branch or the descending portion of the colon. And then as you get to the sigmoid colon, you see that you have the arteries that supply the sigmoid colon. So there's several of them. And then once you get past the sigmoid colon, you work your way into, as you're coming from in to out, it's the rectum. So you're going to have the superior rectal artery. And then you have on the very outside your anus or anal canal or anal sphincter. All right, so that pretty much wraps up the IMA. Now I just need to get Dr. Tato in here to give you guys the big picture connection and help you understand the other branches as the descending aorta bifurcates at L4 and turns into two more branches known as the external and internal iliac arteries, and how one of those branches actually anastomoses with another artery that originates way up here on your subclavian artery. So that's something that I'm going to have him cover real quick. So Dr. Tato, we need you back in here for a quick second.
Hello, welcome back. So John let me know that you guys have now made it to the common iliac artery bifurcation. We're almost done, just hang in there just a little bit longer. So the common iliac artery, we have a bifurcation of the abdominal aorta into the common iliacs, and then we have a second bifurcation into an external and an internal iliac. The branches off of the external iliac are going to be the inferior epigastric artery. This artery goes up the superficial layer and supplies the rectus abdominis, and it's going to anastomose. Anastomose means where a blood vessel connects to another blood vessel. For example, your pancreatico-duodenal arteries that we talked about earlier anastomose with each other, and that's an example of anastomosis. Then we have another artery that we're going to call the ascending branch of the deep circumflex iliac artery. It's one that not a lot of people talk about. It's sometimes thrown in there for testing purposes, just to make sure that you know where it comes off of. The inguinal ligament comes by, and at the point of the inguinal ligament, the external iliac artery turns into the femoral artery. The real meat and potatoes that we want, though, is going to be the internal iliac artery. So we have a mnemonic to remember the branches of the internal iliac artery. It's some inherit money, others inherit insanity usually, isn't life silly. So the pink is going to be the anterior divisions, and the purple is the posterior divisions. So with our mnemonic, we have some superior vesical artery. Just briefly, it's going to provide, vesicle means the urinary bladder. So anytime you hear vesicle, think urinary bladder. Inherit, inferior vesicle, the inferior portion of the urinary bladder. Money, middle rectal. Remember, we had that superior rectal and we have a middle rectal. We're going to have an inferior rectal. Then we have obturator. This is going to supply the blood to the obturator compartment along with the obturator nerve, which we'll get to in lower extremity. Others inherit inferior gluteal. We have a superior gluteal on the other side. We have an inferior gluteal in the same way that we have inferior and superior gluteal nerves. Others inherit insanity. Internal pudendal. This is the one that's going to give a lot of the blood supply to your reproductive organs. Not the testes, but the rest of the reproductive organs. The testes get good blood supply straight off the abdominal aorta because it's very important they get good blood supply for your reproduction. The rest of the organ, whether it be the female anatomy or the male anatomy, is going to get it from the internal pudendal. Usually is uterine, and that's how I think about it, because usually there's females. So uterine artery usually comes off of the anterior division. Isn't life silly? Isn't is iliolumbar. This is going to come kind of down around the ilium and the lumbar region. Life lateral sacral comes down the lateral aspects of the sacrum. Silly, superior gluteal. It's going to go right along with that superior gluteal nerve, and it's going to supply the same areas. So together, those give us the anterior and posterior divisions of the internal iliac artery.
Wow, thank you, Matt. That was so fun. It was fun. And it's always a pleasure to learn because knowledge is power and health sucks, guys. Thank you for watching yet another episode of this YouTube channel. We appreciate it. And if there's anything else that you would like to see, please don't be afraid to comment and subscribe to this channel so that we can provide further educational tools for you guys in the future. Again, Matt, if there's anything you'd like to say to these guys, please do so. Please do so.
Don't forget to like, share, and subscribe. Comment down below how you thought. Comment down below if you think you can do better.
Exactly, because you can, guys. Do it. Let's go.
Later.